Knock knock.
I mean,
Hi, my name's Natalie. I'm going to be your nurse for today. Before we get started, I'm going to be performing hand hygiene and I'm going to close the curtain for privacy. So I'm washing my hands and I'm going to apply my Dawn gloves for this assessment. So before we get started, can I confirm your name and date of birth?
Jesse Hernandez, September 1st, 1992.
Okay, awesome. And then I'm going to be asking you, are you allergic to anything?
No.
And then how do you feel overall? Are you in any type of pain today?
No pain. I'm feeling great.
Okay, so then I'm gonna be assessing your neurological assessment, so I need you to ask me where you are, what day it is, and what time it is.
And the clinic is Monday, 12 o'clock.
Okay, perfect. And then we assessed your vital signs prior to this assessment. So your blood pressure was 120/80, your heart rate was 85, your respiratory rate was 17, your temperature was 98.7, and your oxygen saturation was 98%. So everything was in normal range today. So first, I'm gonna be starting with your head to toe assessment, and I'm gonna be inspecting your head first. So I'm gonna start with your hair, making sure there's no lesions, palpating. Okay, everything looks good. So then I'm gonna be inspecting your ears, the nose, palpating your nose. Open. Okay, so you don't have no signs of drainage, which is good. So then now I'm gonna be assessing cranial nerve 1 olfactory. So I'm gonna have you close your eyes. And I'm gonna have you smell and just tell me what you smell.
Vanilla.
Okay, so cranial nerve 1 is intact. Now I'm gonna be assessing cranial nerve 2 with your optic nerve. And I'm gonna be using the Stellan chart, which your vision was 20/20, so it was intact. So next I'm gonna be moving to cranial nerves 3, 4, and 6, which is trochlear, oculomotor, and abducens. So I'm gonna use my pen. Open. Okay, now follow my pen light. Okay, and then also follow my finger. Okay, so pupils equal reactive to light and accommodation. So cranial nerves 3, 4, and 6 are intact. So now moving to cranial nerves 5 and 7, trigeminal and facial. So I'm gonna have you close your eyes again, and then tell me when you feel this on your face.
No.
Okay, so cranial nerve 5 is intact, and then cranial nerve 7, facial. I'm gonna have you smile, stick out your tongue, raise your eyebrows. Okay, so everything's intact. So then now moving to cranial nerve 9, 10, and 12, which is glossopharyngeal, vagus, and hypoglossal. So I'm gonna have you open your mouth, stick out your tongue. Okay, so gag reflex, everything is good. And then cranial nerve 11, which I'm gonna have you show your shoulders. Okay, so cranial nerve 11 is intact. So then next I'm gonna be assessing your lymph nodes and making sure you have no signs. So I'm gonna be doing your preauricular, postauricular, submandibular, submental, anterior clavicle, cervical, and then supraclavicular. Okay, so no signs of lymph nodes, and then now I'm gonna be assessing your carotid arteries on your neck. Okay, and then for cranial nerve 8, I'm actually gonna perform a whisper test and a lumbar test. So I'm gonna whisper something in your ear and then tell me what you say, okay? What I say, okay?
Sun. Pineapple.
Okay, and then I'm gonna have you stand up to check your balance. Okay, no sign of swaying, your balance is good. So then, now that I assessed, I'm also gonna, inspecting your trachea, making sure there's no signs of swellingness. Okay, so then, now that I've assessed your chest and arms, I'm also gonna be checking for any lesions, your edema, skin temperature, so everything looks healthy, everything looks good. I'm gonna be assessing your capillary refills on your fingertips. Okay, your blood flow is good. I'm gonna be checking your radial pulse. Okay, and then your brachial pulse. Okay, symmetry, your pulse rates are good. I'm gonna be checking your reflex, so just tell me, I'm gonna be feeling. Okay, so your reflex, I'm gonna do it opposite on this side. Okay, so your reflex is good. So then now we're gonna be moving to your heart sounds. I'm gonna be auscultating your heart sounds, so just, so I'm gonna be hearing for aortic. Okay, S2 greater than S1. Pulmonic. Okay, S2 greater than S1. Earth's point. Okay, S2 equals to S1, and then I'm gonna be doing tricuspid. Okay, S1 greater than S2, and mitral. Okay, S1 greater than S2, and then I'm gonna be auscultating your apical pulse as well. Okay, so your heart sounds are listening very well. So now I'm gonna be doing your lung sounds, so you can just stand up. So I'm gonna be feeling your respiratory and expansion, so just breathe. Breathe again. And one more time. Okay, so now I'm gonna be listening to your lung sounds. So your lung sounds are sounding very good. There's no signs of wheezing or any crackles. So then now we're gonna be moving to your abdomen. So I'm gonna ask you a few questions. When was your last bowel movement?
This morning,
Okay, and then since you're a female, when was your last period?
or 5 days ago.
Okay, any UTIs? Okay. So then I'm gonna be auscultating your 4 quadrants for your bowel movement. So I'm gonna be starting with the right lower quadrant. Your right upper quadrant. Left upper quadrant. Left lower quadrant. Okay, so everything looks good. I'm gonna also be inspecting to making sure that there's no irritation. I'm also palpating if you have any pain. No pain? Okay. So then, I'm gonna be, so yeah, no signs of fluids, everything looks, good. So now I'm gonna be moving to your lower extremities. So I'm gonna be inspecting your legs, making sure your edema, skin temperature, the symmetry, everything looks good. Do you have any pain on your legs? No? Okay. So I'm gonna have you move your legs around. Okay, lift them up, down. Okay, so your movement, your reflex is good. I'm gonna be assessing your patella for your reflex. Okay, so everything looks good. I'm also gonna be assessing your pulses on your dorsalis. And then posterior tibialis, your pulse. Okay, and then your capillary refill. I'm gonna do the same on this side. Okay, and then your capillary refill. Okay, blood flow is good. And then I'm also gonna be assessing JVD on your neck as well. Okay, no signs of JVD. Okay, so we completed the head to toe assessment. Do you have any questions, any pain?
No, ma'am, thank you.
Okay, so I'm gonna open the curtain. If you need anything, you can call the ring bell and I'll be happy to